Welcome back to McLaren Port Huron's Today's Health Program. I'm speaking now with Dr. Clark-Paul about breast cancer. Dr. Clark-Paul, before the break you mentioned a gene that increases the risk of developing breast cancer by 60%. Is that a gene, is there a test that women should have to see if they have that gene?
Well, the percent risk may even be higher than that as women get older. And the thing is, though, that unless you have a reason to be tested for it, most women would not be tested for that. Most breast cancers that develop, most of those women don't even have any risk factors. Probably 70% of women don't have known risk factors. So the BRCA1 gene, what you would do, you would be looking if you had a positive family history where premenopausal women develop breast cancer. And if your mother or if your mother and your maternal aunts or sister had premenopausal breast cancer, what you would probably do is you would like to have tested the index case to see if they carry the gene. Because if they carry the gene, then you would be more apt to be at risk for carrying the gene. So normal, a woman that doesn't have increased risk factors, that wouldn't be something that typically would be done.
Now, what are the symptoms of breast cancer?
Most of the time, because breast cancer is diagnosed early now, most of the time it's diagnosed by radiographic screening and women don't have any symptoms. So that's something to be very aware of, that most women don't have any risk factors that we know, and most women, when it's diagnosed, don't have any symptoms. But if you do have symptoms, it would be a change in the appearance of the breast, or it could be a lump in the breast, nipple discharge or nipple changes. But typically by the time you're feeling a lump in the breast, or typically by the time you're seeing skin changes in the breast, some retraction or some evidence, it's called peau d'orange, which is infiltration of the dermal lymphatics, which looks like an orange peel change of the skin. Typically, if you're going to see that kind of thing, it's a more advanced breast cancer. So the majority of women that we see that are diagnosed don't have any symptoms.
Wow, that's scary.
It is scary.
Is there a way to prevent breast cancer?
That's an excellent question. You know, we talked about the risk factors for breast cancer, the non-modifiable risk factors. You can't do anything about that. But the modifiable risk factors, all of us can try to live healthier lives. So try to watch weight, try to be careful about diet and exercise, avoid cigarettes and alcohol. All of those things can decrease risk somewhat. But there are two other things, and one is called chemoprevention. What chemoprevention is that there was a trial that was done it's called the STAR trial, and what it actually does is it looks at something called, it's a SERM, and that is a selective estrogen receptor modulator. And there are a couple drugs that it looked at called Tamoxifen and Preventative. And what those drugs do is they block the estrogen receptors. And what happened is, we saw that in women that had breast cancer that were treated with tamoxifen, which is a selective estrogen receptor modulator, had a 45% reduction in development of contralateral breast cancer. So because we saw that there was a decreased risk of breast cancer with using an agent like that, the question became, can women that are at higher risk use one of these agents as a chemopreventative and possibly decrease their risk of breast cancer? And the answer is yes, that does decrease risk of breast cancer, but we have to be very careful to make sure women are at a high enough risk that it's worth some of the downsides to taking the medication. So what they found in the STAR trial is they found that tamoxifen decreased risk of breast cancer slightly more than raloxifene, but that it had greater side effects. And some of those side effects included thromboembolic disease, which could be stroke or cardiac disease. It included ocular toxicity, and it also included endometrial cancer. So we can use chemoprevention, but you have to make sure that the benefit outweighs the risk. So that's one thing. And the question is, which women are at high enough risk? And there's a tool that we use in the office. It's called the Gale Model. And the Gale Model asks questions of the women. Some of the questions would be the age right now of the woman. It would be the age at menarche and the age at menopause or the age at the first live birth. And it asks these questions first-degree relatives with breast cancer. Has the patient had any breast biopsies, and if so, any atypical breast pathology? And it quantitates the risk based on these questions. And anybody who has a relative risk greater than 1.66 is considered to be high risk and may benefit from a chemopreventative agent. But for the average woman, if they're not at increased risk, then we're not going to use chemoprevention. Now, the other method of prevention, which will seem a little bit radical, is some women say they are BRCA1 positive, or say they've got very dense breast and have had multiple breast biopsies and it's just very difficult to examine the breast. Sometimes women will want to have what we call a prophylactic or preventative mastectomy. And that's would be a very small subset of patients, but that is certainly a risk reduction. It reduces the risk by about 90%, but it doesn't take the risk to zero. So that's another risk preventative. One thing I want to go back, when I talk about tamoxifen reducing the risk by about 45%, that's a 45% reduction in the risk for the woman. So it doesn't mean that it's a 45% overall risk that is reduced by that. So if your risk was 10%, I've reduced it 5%. Does that make sense? Mm-hmm. So it sounds almost better than what it really is. So if your risk was only 2%, I've only reduced it 1% because I've reduced it by about half. And so if I'm only reducing it by 1%, but now you've got an increased risk of these other things, that's where we have to balance risk versus benefit.
Now, how can you detect breast cancer?
That is an excellent question. Sometimes breast cancer is detected because women find something abnormal on their exam. Maybe we can talk about that. When women do a breast exam, the first thing that is to just observe the skin of the breast, and changes in the skin texture, nipple discharge, retraction or puckering would be things that they would look for. And if they find some of those things, they might be concerned and come and have it evaluated. If they're going to do a breast exam, we recommend that it's done making sure that you hit all quadrants of the breast. So whatever way you choose to do it, just do it in a systematic fashion so that all quadrants of the breast are examined. And typically we recommend that you would examine standing and lying down, because sometimes you can feel things one way but not the other. So that sometimes women will feel something and they'll come in because they felt something, but the real way that the most common way that we identify is through screening through mammography.
Dr. Clark-Paul, this is great information. It's time for another break. We'll continue in a moment.
Okay.